Um, so good evening. Namaste and good evening to all of you.
Namaste, sir. Namaste, sir.
Namaste, ma. I'm excited to welcome all of you, especially Dr. Varsha Shamanna, to this edition of Monday evening Zoom meeting. All of you know about NIMHANS Bangalore and the geriatrics unit specializing in treating seniors with mental health conditions. The unit is functioning for more than 25 years. Vayomanasa Sanjeevani is a unique brand that functions under the geriatric unit of NIMHANS and through the initiative of Professor and Head of Department Dr. P.T. Shivakumar with the able support of Dr. Vijay Kumar Hibishadar and other doctors in geriatrics unit of NIMHANS. These Monday webinars meetings are brought to you with the support of students in the department. The webinars are on topics of relevance to seniors for their general guidance. The resource persons are specialists in the concerned field. The unique feature of these meetings are that they are non-commercial in nature and do not promote any product, nor do we endorse any brand. All the people involved in these webinars are doing it as volunteers and do not get any material benefit from these webinars. The advantage for seniors is that they can listen to it from the convenience of their homes through Zoom and YouTube platforms. This evening, we are blessed with a brief knowledge sharing session by Dr. Varsha Shamanna, MD, on the very relevant topic, anxiety in elderly. I also welcome Mr. Sivam and the team who are students in NIMHANS and are providing back-end support for the webinar. I am Jambunathan, a volunteer with Geriatrics Unit of NIMHANS. I have pleasure in welcoming Mrs. Komala, a trained nurse who has recently joined VMS team with a specific role of evaluating various aspects of these Zoom meetings and make them achieve the object. I know I'm not very sure whether she is joined. Okay. So coming back to the resource persons of this evening, Dr. Varsha Shamanna had qualified for her MBBS degree from Shivamoga Institute of Medical Sciences, Shivamoga, currently known as SIMS, shortly known as SIMS in the year 2018. She had completed her MD from NIMHANS with specialization in psychiatry in 2022. She has completed her postdoctoral fellowship in non-invasive brain stimulation from NIMHANS in 2024. Further, she has qualified in the following areas: completion of basic life support course in NIMHANS in January 2024, completion of brief training and reliability protocol for the clinical dementia rating CDR and certified as a CDR rater in April 2023. She has also done a basic course in biomedical research, National Medical Council. Dr. Varsha is considered as proficient in outpatient, inpatient, and emergency psychiatric care with hands-on experience in ECT, TMS, IDCS, and intravenous ketamine administration. She has expertise in research, including collaboration with World Health Organization on mental health screening tools. An accomplished educator with a proven track record in training junior residents, lay interviewers, and primary care psychiatrists. Recognized for excellence in psychotherapy and enhancing patient recovery through multidisciplinary collaboration. She has developed expertise in patient and caregiver education, interpersonal collaboration, technical communication, etc. She is currently working as program coordinator in National Mental Health Survey 2. In her current role, as well as in her earlier roles as postdoctoral fellows, senior resident, as well as a teacher in administrative duties, she has taken up a lot of clinical and non-clinical responsibilities in managing inpatient as well as outpatient, along with care of people having different varieties of mental challenges. In fact, she has such an accomplished doctor, but to introduce her itself is that I may need a one session. Therefore, I'm sorry that I'm not giving all the details about Dr. Varsha. Besides her academic achievement, she has secured several awards and recognitions for her contribution to mental health education. I thank her on behalf of all of you for joining with us this evening to spend her valuable time and share her wide knowledge on a highly relevant topic, namely anxiety in elderly. As far as today's topic is concerned, that is anxiety in the elderly, we are practically experienced in worrying about matters and things on which we cannot do anything, but nevertheless worry, which gets converted into anxiety, leading to many psychological and physiological problems for ourselves as well as for our dear and dear. It is said that worry and anxiety are the two sides of the same coin. Let us learn today from Dr. Varsha the methods of living without anxiety and apply them in our lives. As you are aware, our resource persons are well educated and trained and offer evidence-based possible solutions to many problems so that anecdotal information is totally avoided. However, kindly note that the information shared in these meetings are general in nature, and for any specific matters connected with your health, please consult with your medical practitioner and take treatment as suggested. As a meeting hygiene, I request all participants to keep their mic in mute. If you have any question, please type it in the chat window for the speaker to respond to you at the end of presentation. If time permits, you can raise direct questions to her to respond. Dr. Varsha, let me introduce this group to you. We are a set of mostly seniors, keen and healthy aging for us as well as for the society. With this objective, we listen to experts like you, apply your advices in our daily life, and share the knowledge we gain with our dear and near so that everyone ages in a healthy way. Before opening the floor for your presentation, I like to make a small announcement to my audience. They are that in the coming months, we have lined up sessions on relationship with adult children, risk factors leading to dementia, prostate health in the elderly, etc., amongst all many other subjects. Please do join these meetings and become informed on these matters. The second announcement is that NIMHANS will be calling for a focused group discussion with some of the enthusiastic participants of these Zoom meetings in the second week of February 2025. More information of this will be shared to you shortly. Anyone who likes to attend the voluntary meeting may message me to my number. Thanks, Doctor. Dr. Varsha, the floor is open to you. You can kindly go ahead. Thank you.
Thank you, sir, for such a warm introduction.
Thank you.
I'll just share my screen.
Please, please go ahead. Please go ahead.
Is this visible, sir?
It is. It is.
Okay.
It is.
Okay. So I hope everyone is ready for today's session. Good evening, everyone.
Yeah, we are all anxiously waiting.
Okay. I hope the anxiety is not too much.
That's how to avoid that anxiety. Is
Definitely. Good evening, everyone. So today we'll be talking about an important topic, which is anxiety in the elderly. We'll be covering aspects about how to understand what it is to be anxious, how to identify signs of anxiety, and also how to manage these symptoms of anxiety. Now, before I begin, I'd like to quote this one Subhashita, which goes, Chintayascha, Chitayascha, Bindu Matram Vishishyate. Chita Dahati Nirjeevam, Chinta Dahati Jeevanam. Does anyone know the meaning of this, or has anyone heard about this Subhashita?
Yes. There is a difference between Chinta and Chita, only Anuswara.
Yes.
Then Chita, it will burn when it is dead. Person is dead. And Chinta, it will, when alive, it will burn a person.
Excellent, sir. So, I think that was Ramesh, sir. So, like how sir was saying, the way in which we write Chinta and Chita, there is just a simple difference of a dot. But the actual difference is that Chita is something which burns you after you're dead. But Chinta is something that can burn you while you're alive. So imagine if someone had to make a Subhashita about this in ancient times. This is not a new problem that we are dealing with. And it's definitely something significant enough, right? Now, I've put up a few statements here. You all must have heard something similar to this. Now, can anyone tell me which of these statements is true and which of them is false? I can read it out for you. Anxiety is a normal part of aging. Older adults don't experience anxiety. Anxiety in the elderly is always due to some physical illness. Older adults are less likely to benefit from treatment. Anxiety is just a result of loneliness. Medication is the only solution for anxiety in older adults. Now, which of these statements do you think is true?
Floor is open to you. Yeah. We'll make it very.
Meditation is the only solution, madam.
Nothing
Uh,
is. Nothing is true.
Okay, one of you is saying that nothing is true. Do we have any other answers?
Meditation is the only solution for anxiety in older people, adults.
That is the correct answer. Okay.
That's what I feel. That's what I feel.
Okay. Okay.
Everything is only partially true.
Okay. Anyone else with any other answer?
Older adults don't experience anxiety.
Okay, you feel that is true.
Anxiety is just a result of loneliness.
Okay, you feel that anxiety is just a result of loneliness. That part might be true.
I feel it's a behavioral problems. That's it. Because of
Okay.
their behavior with others and as well as this also creates anxiety. Unnecessary, too much of thinking of something and all that makes them to be very anxious.
Okay. Now, which of these do you think
Anxiety
is
is
true?
a normal part of aging, man.
Okay.
Madam, I'm sorry. I read medication as meditation. I'm sorry, madam. So I'm withdrawing my
That's
answer.
okay. That's okay.
So medication I read as meditation. So I'm withdrawing my.
Yeah, meditation is the solution for this. Yes.
Okay. Now, considering that different people have given different answers, we'll just see a little bit about which of these statements is true. As someone pointed out, none of these statements are true. All of these are commonly held myths or false beliefs that we have. Let's take them one by one and see. The first statement says that anxiety is a normal part of aging. Yes, worrying about your health, about your future, about your finances, they're all a normal part of aging. But when the worry becomes too much, when you're not able to control the worry, when you're not able to let go of the worry, that is when worry becomes anxiety. And anxiety is definitely not a normal part of aging. Okay. Worrying to a certain extent, yes, but definitely not anxiety. Now, the second one says older adults don't experience any anxiety. In fact, if we look at the numbers and if we go to any psychiatry OPD, we find that older adults are actually people who are experiencing more anxiety than everyone else. What generally happens is the symptoms which older adults experience that can get misdiagnosed as something else, which is why we are not able to recognize anxiety for what it is. In fact, older adults have higher rates of anxiety than compared to young people. Now, the third one says anxiety in the elderly is always due to physical illness. Not necessarily. It can be because of various factors. It could be because of social isolation. It could be because of worries about health, worries about physical problems. It could be because of you don't have financial independence. It could be because you've lost someone close to you. It's not just physical illness. It could be a interplay of a lot of other factors as well. The next statement says older adults are less likely to benefit from treatment. This is, in fact, one of the most harmful myths that we have. So, if we end up thinking that, okay, in older adults, treatment does not make a difference, then a lot of people keep feeling that, okay, if nothing is going to help, what is the point in getting treated? Now, this one particular statement can end up harming a lot of people because definitely it is treatable, whether it is medications, lifestyle changes, or therapy. definitely treatable. Anxiety is just a result of loneliness. Like how we discussed previously, it's not just loneliness. There are a lot of factors contributing to it. And the last one, medication or meditation is the only solution for anxiety. Not necessarily. There isn't just one single solution for this problem. Some people might require medications. Some people might require counseling or therapy. Some people might just benefit with lifestyle changes. So it's not always that people need medications to feel better. Yeah, I hope that clears some of the doubts. Moving forward, we'll look at two stories here. And you can tell me what is the difference between the two stories once we've looked at both. First, we'll look at the story of Mrs. T. Mrs. T is a 72-year-old retired teacher. She recently scheduled a routine checkup with her doctor. She's generally healthy, but she has noticed some mild discomfort in her knee, and she's worried about possible arthritis. As the appointment date approaches, she thinks about her knee pain more often. She wonders if her mobility will decline and whether she'll need to rely on a cane or a walking stick, or whether she'll even be confined to a wheelchair. She also feels concerned about how the potential diagnosis might affect her daily activities, like gardening or walking her dog. As the checkup approaches, Mrs. T acknowledges that these thoughts are just part of her routine worrying. She's still able to manage her daily tasks, continue with her hobbies, and maintain her social connections. The worry doesn't interfere significantly with her ability to enjoy life or to make decisions. When she arrives at her appointment, she expresses her concerns and her worries to the doctor, who reassures her that it's a common issue and provides some advice on managing the discomfort in her knee. Mrs. T feels a sense of relief after the conversation and is able to go back to her daily life without any ongoing distress. Now, this is Mrs. T. Now, let's look at Mr. E. Mr. E is an 80-year-old widower. He has always been an active man, enjoying his morning walks, reading, and spending time with his children. Recently, he's begun to experience overwhelming, persistent worry about his health, even though his medical checkups have been mostly normal. He finds himself constantly preoccupied with the idea that he might develop a serious illness like cancer or Alzheimer's, despite no evidence to support these fears. He spends hours each day Googling his symptoms, comparing his own health to the worst case scenarios, and feeling like his body is betraying him. This worry goes beyond occasional thoughts about his health. It's all consuming. It's all he can think about. Mr. E has trouble concentrating on anything else. He becomes excessively fatigued from the constant mental strain, and his appetite diminishes due to anxiety about his health. He has trouble sleeping, wakes up frequently with a racing heart, or feeling like he can't breathe. He avoids social gatherings, afraid that others will notice his symptoms or that something might happen to him when he's away from home. Despite reassurance from his doctor, who confirms that his health is stable, Mr. E's anxiety continues to escalate, continues to increase. He begins to cancel all his plans with friends and family. He becomes irritable and feels increasingly isolated. His daily life is significantly disrupted by his persistent and irrational fears, and he begins to experience physical symptoms like dizziness and muscle tension. Right? Now we've heard two stories, one about Mrs. T and one about Mr. E. Can someone tell me what is the difference, or if there is any difference between these two stories?
Mr. E is a hypochondriac.
Okay, we'll not label anyone or use terms like that. Mr. E has some worries about his health. Let's put it in a positive way. Okay, good observation.
Mr. E is a negative thought.
Okay.
Mr.
Can
E
anyone?
doesn't, yeah,
So,
Mr. E doesn't have, I mean, he did not have to be worried about all this. without basis for any symptoms or anything, he is unnecessarily worrying.
Okay, very good.
His worries, normal worries becoming an anxiety. That's what we are talking about. That becomes
Very good.
Mr. E is over generalizing.
Okay,
Overwhelmed probably. Sit. What you wanted to convey is overwhelmed and overthinking about himself.
very good. So we see that in both the stories, both these people are worried about their symptoms. But for Mrs. T, the worry is not so much that she's not able to do anything else. She's still able to continue her daily tasks. She's able to continue with her hobbies. Whereas,
One important factor is that Mrs. T is 72 years, whereas Mark is 80 years old. Therefore, I mean, because of his age also, he may be thinking like this, isn't it?
it could be, but that might not be the only reason.
I understand. Thank you, Doctor.
Okay. So, like we were discussing, both of them are worried about their health. But the worries which Mrs. T is experiencing is drastically different from what is happening with Mr. E. Mrs. T is worrying about it, but it's not 24/7. It's not the only thing that she can think about. And when she goes to the doctor and she expresses that she's worried about it, and the doctor tells her it's okay, there's nothing wrong. For that knee pain, I can give you something. She's able to take it. She's able to say that, okay, there's nothing wrong. And she's able to go on with her daily life. Whereas with Mr. E, he's becoming more and more involved with his worries. He's just not able to pull himself out of it. And even after going to his doctor and getting reassured, he's not able to come out of it. In fact, what is happening is he is going away from all his friends, all his family, tending to be more and more alone. He's becoming angrier by the day. So it's leading to a lot of chaos. Right? Now, that is the difference between normal worrying and worry related
Madam
to anxiety.
Madam T's doctor is most positive.
Yes, sir. Okay. Now that we got the difference between the two, let's look at what exactly anxiety is. Anxiety is, in fact, a natural and often protective response to stressful situations or situations where you feel there is some sort of danger. It's a very normal emotion which is felt by all human beings. Now, anxiety becomes a problem only if it's happening too frequently. If the feelings of anxiety are too intense, the feeling is so intense that you can't concentrate on anything. If it's happening for periods of time, long past a frightening situation. Let's say there was a situation where you were stressed. The situation has passed, but you're still feeling anxious. Sorry. Then anxiety also becomes a problem if it is uncontrollable. As in, you can't stop yourself from feeling anxious once it starts. So normal worry, when it becomes too frequent, too intense, lasts for longer periods of time, or becomes uncontrollable, ends up becoming anxiety. Right? Now, anxiety generally has three sorts of symptoms. One is physical symptoms, as in how the body reacts to the anxiety. The second one is there are some anxious thoughts, which is what is going on in the mind. Then there are some behavioral symptoms. Behaviors are basically actions which occur along with the anxiety. Now, why is it so important to talk about anxiety in geriatric population? Before we move on to that, why is it important to talk about mental health issues in older adults? Why do you think it's important to talk about these issues?
They are often neglected issues, Doctor. Mostly.
Very good.
Mostly what happens, normally if there is a mental problem, first thing what we do is, we try to go to some temples, go to some priests and to do some pujas, this, that, etc., etc. We are not willing to accept. That's a denial is the first thing. We start with denial. We start with denial, especially with.
So I think we lost you there. Go on, sir. Go on.
It's also important because more in our social context, mental health issues considered as something one should not have, whereas it is something which we need to recognize. It is fine to have it. It's okay not to be okay. And therefore, the more people know about it, they don't have any kind of a stigma attached to it. And once you address that, then obviously an aspect of anxiety also gets addressed, because then people say, okay, anxiety is also not such a big issue. It tends to happen. We just need to live with it.
Very good. Anyone else has any other thoughts?
Yeah, actually, once people become aged, there is a possibility that the support system might have come down. And second, physically, they might be weak. So
Very
if
good.
the anxiety is more, the physical weaknesses get aggravated or multiplied. So it's better not, once you are, when you are young, this anxiety may not affect your health, but as a aged group, your anxiety may affect his health.
Very good. So all of you have covered all the points that I
One
wanted
more,
to.
one more point.
Yes, sir.
The attitude makes a lot of difference.
Mm-hmm.
See what happens physically is affected,
Right.
and mentally, if he is able to be strong enough, then his physical discomforts he can overcome.
Mm-hmm.
These two in turn, thirdly, it also affects in the emotional balance also.
Very
so
good.
all are interconnected. So the mental well-being is more important, equally important than other two also.
Excellent point.
All are to be taken care.
No, but
Excellent point.
environmental attributions or environments in and around that aged people, including home or society or.
So I'm not understanding if there's a question there.
Yeah, environmental aspects.
We'll come to that in a little while, sir. Right now, we're just talking about why is it important to talk about mental health issues in older adults.
Ma'am, older people will have less tolerance.
Very good. Less tolerance in what sense, sir?
Less tolerance to any anxieties or any worries, whatever thoughts or even small issues, they make it a very big,
Okay, it's not something that is happening by choice. It's something that happens generally itself, right? Right. So, like all of you mentioned, it's important to talk about mental health in older adults because mental health is one of the most important parts of overall health. It's not just physical health. If you're completely fine physically but not feeling so great mentally, your days are still not going to be okay, right? So
Loneliness.
loneliness. Yes.
For a trend. Nobody is interacting, even in the family or surrounding people. They are neglecting senior persons. That is one reason.
Yes, that is one of the very important reasons.
And not
Now,
only that, people may feel that it's okay, age is in this age, these are all the things normal, so there is nothing to worry about it. So people may leave it that way. It's okay because his age is doing that, all those things. With age, people may be behaving like that. There's nothing wrong.
yes, very, very important point. Now, if you remember, we spoke about a few sentences which might have been true or might have been false. Now, all of those sentences which were put up there were actually false, but a lot of us felt that one or two sentences here and there may be right. Like we thought that worrying was a normal part of aging, or that older adults have lesser rates of anxiety and it's not as severe. So, one thing, it's important to talk about all of these because there's a lot of stigma associated with it. There's a lot of myths or false beliefs associated with this. And mental health or mental well being is something that is important for overall well being. So, mental health again has direct relation with physical health. How physical health can impact mental health. Similarly, mental health issues can impact our physical health as well. And one of the most common disorders which can have an impact on physical health is anxiety disorders, which is why it becomes a very important issue to talk about. Now, we spoke about anxiety, how it can come up in different situations. Now, like all of you mentioned, worrying is a part of normal change in mood and your mental state as you grow old. Now, is that equivalent to anxiety? Not really. What are the changes, or rather, what are the differences between anxiety disorders and age-related concerns? They may involve the same sort of problems, that you're worried about your physical health, you're worried about your future, you're worried about your finances, but age-related concerns are limited to some specific things, and after a while they sort of settle down. It's not that you're thinking about it 24/7, and it's not that those worries are the only thing that you can think about. You're not able to do any of your other hobbies. You're not able to concentrate on your day-to-day work. It is not like that. Once it becomes persistent, once it becomes severe, once it starts interfering with your daily functioning, that is when it becomes an anxiety disorder and not a normal change in mood. Okay. Now we have different types of anxiety disorders.
Just 1 minute.
Now,
Just
yes,
in the previous slide, you have shown.
yes, sir.
Yeah, see, the previous slide you have shown some brain figure.
Yes, sir.
Can you just explain a little more on that right hand side of the brain? Yeah.
Yes, sir. So, very, very observant of you to notice that small Easter egg I had placed there. Now, what can happen in anxiety disorders is that we spoke about a lot of factors which can lead to anxiety problems. Now, why do these symptoms occur? These symptoms are occurring because there is some small change in the chemical structure of the brain. There are some hormones or some neurotransmitters or some chemicals which are not really being produced correctly in the brain, which can lead to symptoms. Now, there are different methods of handling this decreased production, which we will come to a little later. Now, this is one point I wanted to highlight, which is why that particular symbol was there. Very observant of you, sir.
Thank you, doctor. Thank you, doctor.
Right. We were talking about different types of anxiety disorders. Now, there are multiple different presentations which we can club together under the heading anxiety disorders. The commonest ones I have listed here. One is generalized anxiety disorder, where you're worried about anything and everything. Let's take a simple example. Let's say you have kept rice to cook for your lunch. Now, for whatever reason, the cooker is not building up pressure as expected, and it's taking maybe a couple of minutes longer for the whistle to blow. Now, the thoughts in your head might be that maybe I did not pour adequate water. What if I forgot the gasket? What if the cooker just builds up a lot of pressure and explodes? What if there's something wrong with the gas? What if the gas cylinder bursts? And all of this. And then the cooker whistle blows. And then the rice is done. You sit down to eat. Then you find that maybe for the sambar or the rasam, you've just added a little more spice than usual. You end up thinking, I've added so much spice to it. What will my son think of it? Or what will my daughter think of it? What will my family members say? What if because of the spice levels that I eat, what if I get gastritis? And what if the gastritis goes to something else? Now maybe I should go drink some water. You go to the filter and you're trying to collect some water, but the filter has not collected enough water. And you end up thinking, okay, what if something's wrong with the filter? What if the filter is not working? Maybe the filter has not been working for a lot of days. What if there are so many bacteria in it? What if there is dust in it? What if I've been taking all of that? What if I fall ill? You see how the thoughts are not making a lot of logical sense, but they continue coming one after the other, and you're worried about everything. There is nothing that you can't worry about. Now, that is what happens in generalized anxiety disorder. It's not that these thoughts are under your control, they've gone out of control, and you're worrying about everything under the sun. Right? That is about generalized anxiety. Now, the other form in which anxiety disorder can occur is something called panic disorder. In panic disorder, there are these discrete episodes called panic attacks. Now, panic attacks are severe anxiety attacks which start suddenly without any reason. They last for about 15 to 20 minutes or sometimes 30 minutes. And it starts suddenly and increases to such an extent that you feel like, okay, there is something wrong happening. I will not survive this. There are a lot of physical symptoms. You can feel your heartbeat, you're sweating, you're shaking, you're not able to concentrate on anything, you're feeling like you can't breathe. All of these intense symptoms, and gradually it comes down. There is no particular trigger for it. And because there is no trigger, you can't really predict when a panic attack happens. Now, such a panic attack, if it keeps happening again and again, it can be called a panic disorder. Then there is something called social anxiety disorder. Social anxiety is where your anxiety is the maximum when you're in social situations, when you're interacting with someone. What if I say something and they think negatively about me? Or simple things like what if they comment about my dress? What if they comment about how I look? Or what if they comment about something I said or did? It can be as simple as when you're going out to eat. What if people negatively think, or what if people criticize me for the way I'm holding my spoon, for the amount of food that I'm eating, for the type of food that I'm eating? So your entire anxiety is concentrated about what others think of me. And the anxiety, in fact, becomes so much that you don't want to meet people. You feel that if you meet people, you're going to feel anxious. So the best solution is not to meet people at all. So that is something called social anxiety. Specific phobia is something that is the opposite of generalized anxiety. In generalized anxiety, you're worried about everything under the sun. In specific phobia, there is one particular thing that you're extremely worried about. It is not as simple as I'm worried about a dog coming near me because I don't know, some 5 years back, I was bitten by a dog. So now I'm worried about dogs. That is not a phobia. A phobia is irrational fear that, I've never been bitten by a dog, but I'm still scared of the dog. If there is a dog in a crossroad parallel to my house, I'm scared to go home. If I see a dog some 100 meters away, I'm still scared. But despite me being so scared, I can't stop looking at pictures of dogs, reading about dogs. It's somewhat of an obsession for me. So there is some sort of a curiosity about it, but there's also a fear. And this is related to that very particular thing. And it's not normal amount of fear. You get panic attacks, you start trembling, you just want to avoid those situations. That is a specific phobia. Just hearing about all of these may make some people feel like, okay, this is too much. How can some people end up feeling like this all the way? That is the point of anxiety disorders. People are always on edge. People are always, looking out for danger. They're not able to rest. That is what makes life difficult. Okay? Now we looked at different anxiety disorders. How common is it in the elderly? Does anyone know how common it can be? Okay, I can help you out with this. So in around 2015, 2016, there was a national mental health survey conducted in India. So it was kind of like a census, but here people were asked about the mental health issues that they were facing. And surprisingly, in this, what they found was nearly 5% of India's population is dealing with some or the other anxiety disorder. Now, for a population such as ours, that could mean anywhere close to 4 crore people suffering from anxiety disorders. Now, it's not a very trivial number, right? The numbers are huge. Among this, they found that, yes, the numbers are extremely huge. Among this, they found that in people above 60 years of age in India, out of every 100 people, 5 people qualify for some or the other anxiety disorder. That is 5% of the elderly in India suffer from one or the other form of anxiety disorder. We're saying anxiety disorder and not just normal worrying. So that is how huge the problem is. Now, what we also found was over the years, the rates of anxiety keep on increasing. Somewhere in 2010, it was around 3%. By the time it was COVID time, it was around 5 to 7%. So it just keeps increasing. Now, what are all the factors which can contribute to this rising levels of anxiety? Like all of you pointed out before, it could be physical health problems. Maybe someone has diabetes, some heart problem, some kidney problem, and they're worrying more and more about that, worrying so much that it ends up being an anxiety disorder. Social isolation and the loss of close relationships, cognitive decline, or forgetfulness, which can be a normal part of aging. That itself may cause anxiety in a lot of people. The fear of cognitive impairments, the fear of forgetting things, the fear of not being able to take care of oneself, that can lead to anxiety disorders. Loss of independence, whether it is physical mobility, financial independence, whatever it is, independence lost in any way. Financial concerns, fears of institutionalization. There is always this fear that what if my children cannot take care of me? What if they tell me I need to go to some home? Then what do we do? It's a common fear that a lot of people in our country have. Then the normal process of aging itself can be anxiety provoking for a lot of us. And most importantly, if there's a previous family history of mental health issues, that itself can predispose someone to develop anxiety disorders. Now, how does this anxiety affect our daily life? One, it could have some impact on our physical health. It could impact our sleep. It could lead us to feeling tired or fatigued throughout the day. It can also lead to increased pain sensation. Anxiety itself can lead to social isolation. Like how I said in social anxiety disorders, you feel that, okay, if I'm interacting with someone, I feel so anxious, so best is not to interact with anyone. That itself can lead to social isolation and reduced quality of life. Anxiety itself can lead to impaired cognitive functioning. Then anxiety can lead to decreased participation in daily activities. Through all these ways, our day-to-day activity can be affected. Now, we spoke about anxiety manifesting as physical symptoms, as emotional or psychological symptoms. When we talk about physical symptoms, what exactly do these physical symptoms indicate? Why do we have physical symptoms? Can anyone guess?
Because it affects our day-to-day life. That is why we get into these physical symptoms.
Okay.
Mental and physicals are all linked, madam. If something affects on physical, mental effect. Everything is mind, and mind controls the body in other way. So more and more the physical down, the mind loses its control, and more and more you get into the physical land. It's like a spiraling. It starts
Very
with
good.
somewhere, either in a mental or a physical. It becomes spiraled and spiraled and spiraled and goes up.
Yes. Anything else?
Sometimes we may react. Our actions may not be appealing to the other people. It may not be in decorum with the requirement of the society.
Right.
Our behaviors are totally different. That may be the another physical symptom.
Okay. Anything else?
As we get aged, we also become a little weaker in all our activities, madam.
Okay. Right. So a lot of you had have covered a lot of the answers that I was hoping I could give. So you have made my job easier for me.
That's also.
Yeah. Somebody else wants to talk? Please, go ahead.
No, I said restlessness. Also
Yes.
one of the symptoms.
Yes, very good. Right. Now,
They
before go ahead, ma'am.
They will not be concentrate at any work. They are very restless, and they are, they cannot concentrate at one work at a time. They will be, moving here and there. And this is nothing but restlessness. That is what I feel.
Excellent.
That's the cause of the anxiety.
Right. So we all spoke about different.
Only one request: whoever wants to talk, let them also switch on their video, so that people can see. That's my only request. Kindly go ahead, please. Okay.
Right. So now, before we talk about how different symptoms can manifest, why exactly do we have physical symptoms? If you remember, anxiety is actually a normal response. Only when it becomes uncontrollable do we call it pathological. So when is it normal to have anxiety? When you're in a dangerous situation, for example. That is when you need to be on alert and you need to look out for any danger in your vicinity. You need to be prepared for it. So in situations where you're in danger, what actually happens is that the blood from all your fingers and all your toes, it gets a little reduced and goes to the part where it is more required, which is the muscles. So it's common to feel that your hands are going cold and your hands are tingling, right? The other thing is, when you're in a very stressful situation, your body needs a lot more oxygen to function. So you end up taking a lot of shallow breaths and you end up breathing fast. Sometimes what can happen is it can end up making you feel breathless. So these are all the physical symptoms. That is why we have physical symptoms. Now, the common symptoms of anxiety include heart palpitations, dizziness, chest tightness, shortness of breath, gastrointestinal problems such as nausea, stomach ache, and diarrhea, muscle tension, sweating, shaking or trembling, dry mouth or throat tightness, headache, fatigue. Now, these can all be the common physical symptoms which can occur in anxiety. Right? All of these are normal if you are in a dangerous position or there is something stressful happening and your body needs to react immediately. But without there being danger, without there being a stressful situation, if you're finding all of these symptoms, that means it's mostly part of anxiety and not normal worrying. Right? Now, those were the physical problems. Coming to the emotional and psychological. Just a second. Coming to the emotional and psychological symptoms. Now, there can be excessive worrying, there can be a fear or sense of impending doom. It might just feel like, okay, the world is going to end. I am not going to survive this. So that is what we mean by sense of impending doom. Anxiety can also manifest as irritability. When you're always, in search for danger, when you're thinking this could go wrong, that could go wrong, your patience levels also become very low and you become extremely irritated. You become angry very easily. Little things start disturbing you. There can be difficulty concentrating or feeling cloudy, that you're not able to think clearly because your mind is thinking about X, your mind is thinking about Y, your mind is also thinking about Z. So you can't concentrate on one particular thing. There's also restlessness or feeling on edge, that you just can't relax yourself. There is this fear of losing control, that what if I have some physical symptoms and everyone notices? What if I break down and everyone around me notices? What if I don't have control over my symptoms? All of these can also be manifestations. Then there is a sense of detachment. After a while, what starts happening is everything around you starts seeming very unreal, that it's somehow not connected to you, that it's somehow like in a dream. It doesn't feel as real. There could also be overthinking or catastrophizing. What do we mean by catastrophizing? Always thinking of the worst possible scenario or worst case scenario. A simple thing can end up leading to a situation in your mind where either some harm comes to you or some harm is coming to someone or something major is happening. A simple thing such as a whistle not blowing on time, right? It could also lead to a lot of avoidance behavior. Like I said, social interactions are very scary for me, so I won't interact with anyone at all. So I'm going to avoid social interactions, or I'm going to avoid doing certain things which make me feel anxious. Now, constantly, if I'm doubting myself whether I'll be able to do well in this situation, whether this will go right, whether I'm capable of this, when constantly I'm thinking about all of this, it can lead to a lot of self-doubt and low self-esteem. Now, these are all the ways in which emotional and psychological symptoms can manifest. Okay. Now, coming to another important point, which is anxiety and comorbid conditions. Now, in a lot of people, anxiety comes along with additional baggage. Now, that could be anxiety along with depression, or it could be anxiety with some cognitive decline, like dementia or Alzheimer's. It could be anxiety and substance use disorders, like taking more and more of alcohol or taking more and more cigarettes or BDs to calm yourself, or taking more and more um, sedatives or tablets which can help calm you down. Anxiety and chronic physical illness. If you already have something like arthritis or diabetes or some kidney problem, you're always worried about it. What can happen is your worries can influence the physical health problem, which in turn can lead you to have more worries, and it's a vicious cycle. Now, someone who's anxious all the time will obviously have some sleep problems as well. So anxiety is generally associated with sleep disorders as well. Now, for someone who has experienced a lot of trauma in their life, something called post-traumatic stress disorder can come up. So post-traumatic stress disorder can come along with anxiety. And when you have a lot of anxiety, it can bring up a lot of memories of previous trauma. So both the conditions end up complicating each other, which is important, which is why it becomes important for you to seek professional help whenever required. Okay. Now, how do you recognize that, okay, this is actually not normal worrying. This is actually anxiety symptoms that we are seeing. One is that there are some behavioral cues or behavioral clues. So one is that the person becomes extremely avoidant. They stop going to functions. They stop interacting with people. They stop doing things that they are normally supposed to do. There is reluctance to engage in activities, which is not normal. Then there are verbal cues. Some people may repeatedly keep expressing that I'm worried about this or I'm scared of this. So that also, if it's happening more than what is usual or what is usual for that particular person, then that also is a pointer that this person might have some anxiety disorder. And when there are physical symptoms, worries which we generally have about, okay, will my presentation go okay or not? What about financial issues? Will they get sorted out or not? All these worries that we have are not generally associated with physical symptoms. When there are physical symptoms happening, like there is changes in sleep or change in appetite, they either don't feel hungry at all or they feel hungry all the time. Some physical symptoms like this happening, that is a clue for us to say that, okay, there might be some anxiety disorder rather than normal worrying here. Okay. Now, how do we diagnose anxiety? When to actually seek professional help? One, when the symptoms become persistent or continuous, when they start interfering with daily life, when there are physical symptoms, when there are panic attacks. Remember, we spoke about how there are episodes of intense anxiety for 15 to 20 minutes, and there are a lot of physical symptoms. Those are panic attacks. When there are panic attacks, you will have to seek professional help for that. And when it becomes difficult to control your anxiety or to control your worries, you feel that it's going out of control. And when there are co-occurring mental or physical health issues, that is when you will have to seek professional help. Now, professional help is usually given by a psychiatrist or a qualified psychologist. Now, what is their role in diagnosing anxiety? First of all, their first job is to see whether this is normal worrying for their age or whether it's an actual anxiety disorder. If it qualifies for an anxiety disorder, see how severe it is, whether it is mild, moderate, or whether it's a very severe condition. Then come up with treatment plans. Now, the treatment plans may include giving some medicines, giving counseling, or advising lifestyle changes depending on how bad the person's anxiety is. Now, these are all the roles of the psychiatrist or the psychologist. Okay, now, like I mentioned, the treatment options could be medications. It could be antidepressants, anti-anxiety medications. It could be some form of psychotherapy or counseling, of which cognitive behavioral therapy, something that we call CBT, is one of the most commonly and most effective uh, methods or techniques of therapy. Then it could also be treated by lifestyle changes like relaxation techniques, regular exercises. I'd like to concentrate a little more about lifestyle changes. We'll come to that in the following slides. Now, first, a little bit about medication management. There are multiple classes of medications available. These are all the technical terms that we use. Something like sertraline or escitalopram belong to a class of medications called SSRIs, or selective serotonin reuptake inhibitors. Now, what this class of medication does is when... Yes, ma'am?
No, you can go ahead, please.
Oh, okay. Right. Remember when we were talking about how anxiety can actually cause a lot of chemical changes in your brain? It can decrease the amount of certain neurotransmitters or certain hormones in the brain, right? So to treat that, what SSRIs do is increase the level of one particular chemical called serotonin. So the amount of serotonin increases, so the mood improves and the anxiety symptoms come down. Now, the second class is serotonin norepinephrine reuptake inhibitors. This acts on both serotonin and something else called norepinephrine. Again, it will lead to a reduction in anxiety symptoms. Benzodiazepines are something that can help with sleep, something that can help bring down anxiety immediately. Buspirone, again, is something that can act on serotonin and one more molecule called dopamine. Then there are beta blockers, which can help control the physical symptoms of anxiety. And in rare cases, some antihistamines also can be used for management of anxiety. Now, the caveat here is that particularly when you're giving it in older adults, you'll have to be very careful with the dose. Because what generally happens is older adults already have a lot of physical comorbidities. Most of them might even be taking medications for diabetes or hypertension or cholesterol. Now, we don't want there to be interactions between the drugs. So you'll have to be very careful in selecting what sort of drug you want to give. And lower doses itself may cause a lot of side effects, which is why medication management is something that we come to only when it becomes absolutely necessary. If not, we can use psychotherapy. Now, before going into the different schools of psychotherapy, we'll just have a look at what psychotherapy deals with. Now, psychotherapy can be dealing with thoughts and with your behaviors. Now, there are some anxious thoughts which we were mentioning earlier as well. Now, thoughts become the mental component of the anxiety response. Like how we have physical responses, the mental responses would be the thoughts that we have. Now, these thoughts could be worries about either myself or about others, and it could be about health, it could be about family or friends. It could be about work or school. It could be about finances, daily events, or normal age-related issues. So the concerns can be about anything, right? So this forms the thoughts component. Now, there are some behaviors. Behaviors are nothing but the actions that are associated with the feeling of being anxious. Now, behaviors can be of two ways, anxious behaviors. One is that something you should be doing, but you don't. So behaviors you don't do, as in you avoid doing. Or it could be that behaviors that you do too much. Like, let's say, repeated checking, repeatedly asking someone, did you lock the door or did you switch off the light? Asking once or twice is fine, but asking 5 times, 6 times, that becomes behaviors that you do too much. Now, psychotherapy is something that can deal with these thoughts and with these behaviors. There are different forms of psychotherapy. The commonly used one is something called cognitive behavior therapy, where we look at the thoughts, whether they are right or wrong, and how do we replace the wrong thoughts. Then there is something called acceptance and commitment therapy, where instead of fighting your anxiety, you accept that, okay, anxiety is normal, it's just that it's out of proportion in this particular context. And how do I bring it down? You also use a lot of mindfulness techniques, which is you just non-judgmentally see that, okay, right now I'm anxious, I'm becoming aware that I'm anxious, and I need to take steps to bring down my anxiety level. Then there is something called exposure therapy, particularly for someone who's avoiding to do a lot of things. Let's say I'm scared of doing something. By exposing myself to that particular task little by little, my anxiety gradually comes down. Then there is something called psychodynamic therapy, where we look at what might actually be causing this anxiety, what past events might be leading up to it, and whether if we resolve those past events, will the anxiety come down. Then there is mindfulness-based stress reduction, where you learn a lot of coping strategies to bring down your stress levels. There is supportive psychotherapy. Again, this also deals with a lot of usual coping strategies and stress management techniques. Then there is group therapy, where we all get together as a group and learn from each other's experiences. That when I'm anxious, this is what I do, and it makes me feel better. So maybe that is going to help someone else as well. So we learn about each other and also learn about what is helping each of us in coping with the anxiety. That is what group therapy is about. Right? Now, coming to the most important part, which is lifestyle changes to manage anxiety. One,
Okay, go ahead. Please.
Yes.
I'll mute them.
Okay, sure. Thank you. Right. Some of the lifestyle changes that we advise to bring down the anxiety levels is regular exercise. Now, this might seem like, okay, every other doctor is, telling us to exercise. Now, why is it so? Because when you exercise, what happens is the level of stress hormones comes down. Something called cortisol, which is the stress hormone, actually decreases. And then there are some other hormones, such as endorphins, which get released in your brain, which actually makes you feel much, much better. They're called happy hormones. So these are released and stress hormones come down. So regular exercise for at least about 30 minutes in a day, at least 5 times in a week, is something that is recommended. And by regular exercise, it can be as simple as going for a walk. It need not be something like cycling or jogging or swimming. It can just be a simple walk, right? Healthy diet. Again, if the brain is not getting all the nutrients that it requires, it cannot produce the chemicals that we require, which is when all these anxiety symptoms can start happening. A healthy, balanced diet is something that can help prevent anxiety as well. Sleep hygiene. So having a proper sleep schedule and maintaining a sleep timetable so that there are no distractions in between. Again, we'll talk about this a little later, is something again that can help us with managing anxiety. Mindfulness and relaxation techniques. Then increasing social support and connection. The more emotional connection we have, the more group support we have, the more social support we have, the better it becomes to manage our anxiety. Then there are also stress reduction techniques and time management skills that can bring down anxiety. Another important thing is limiting alcohol and nicotine use. Sometimes what happens is a lot of people say, I feel so anxious. To control the anxiety, I drink alcohol. Now that can help in short term, But what happens in the long term is that anxiety, in fact, keeps increasing, and you will have to end up taking more and more substance just to bring down the anxiety. So that can lead to a lot of other problems. Same thing with nicotine. Now, engaging in hobbies and activities that you enjoy can actually provide a distraction measure so that you're concentrating on something that you actually like rather than concentrating on your worries. And then this may seem a very generic sort of advice that practice gratitude. But what happens is every day, if you list out all the things that you're grateful for, and if you start feeling anxious about, I don't know, I don't feel I have a lot of friends, or I don't feel people like me. And then you look at your list, you actually have a lot of things that are positive in your life and that you are grateful for. So it helps to, again, um, keep you focused on the positive things in life rather than the negative ones.
Maybe this is called as gratitude attitude.
Yes, sir. Okay. Now, coming to how to actually reduce anxiety. The first step is that realizing or becoming aware that you're actually anxious. Only when you recognize there is a problem can you look for solutions, right? So the first step is always becoming aware that, okay, I'm feeling anxious. Right now, I may have some physical symptoms. My thoughts are not in my control. They're spiraling. When you start recognizing all of this, that is when you can start taking steps to correct it. Now, let's say you've recognized that you've had physical symptoms. The next step is to learn coping skills. And for physical symptoms, that would be using some relaxation techniques. For controlling thoughts which feel out of control or which feel like they're spiraling, there are some skills which you can learn to change your thought process. Now, changing anxiety related behavior, like maybe frequently checking or avoiding doing something, you can learn problem solving skills and face situations. Then, for sleep issues, which becomes very important, sleep hygiene techniques and other sleep skills can be practiced. We'll concentrate a little bit about each of them. Now, one of the relaxation techniques that is the easiest to practice is something called diaphragmatic breathing. Two things you have to remember here is that you have to take long, deep breaths, and you have to make sure that the action of breathing occurs in the diaphragm and not in the chest. What do I mean by this? A simple way to see it is to place your hand over your stomach, just above your belly button or just above your navel, and then take a long deep breath. So if you're breathing in through your diaphragm, when you breathe in, your hand should move out, and you breathe out, or when you exhale, your hand should move in. So your stomach should actually expand when you're inhaling, and it should is when you start breathing in, don't hold your breath. As soon as you finish inhaling, exhale, because when you try to hold your breath, that creates a lot of tension and tightness in the chest muscles that can add to the physical symptoms of anxiety. Now, practicing this for 10 to 15 minutes a day as routine, whether you're feeling anxious or not, will actually make it easier for you to practice it when you're actually feeling anxious. Remember, when we spoke about physical symptoms, we said that when we're anxious, we end up taking very fast breaths and very tiny breaths. So when that is happening, diaphragmatic breathing is something that can help. Then we have something called progressive muscle relaxation. So in this series of exercise, what we do is target 7 muscle groups, starting from the right arm, face, neck and throat, torso, right leg, and then left leg. What we first do is start contracting each of these muscles. Try to hold it in tension. And then once you realize what this tension feels like, you slowly relax it. Now, you might think that the whole point of this is to relax the muscles. Why are we tightening it in the first place? Now, the feelings you get when your muscles are tight are very different from the feelings you get when your muscles are relaxed. So, if you can recognize how it feels when your muscles are tight, you can start doing it automatically. Particularly when you're anxious, You may notice that, okay, right now I have some tightness in my right arm, and immediately you can start relaxing those muscles, right? That is the reason for tightening it first and then relaxing it. However, if you already have some physical condition where tightening your muscles can cause pain, you can skip the tightening part and directly go to the muscle relaxation part, right? Then we have a technique for changing thoughts. So when you recognize that one particular thought is making you feel very anxious, you can use something called the react strategy. First is to recognize that this thought is making you anxious. Second is to evaluate whether this thought is true or not. Not all the times, just because we have a thought, it doesn't mean that it's right. Just because I have a thought that the sky is orange does not mean that it is the correct thought, right? So evaluate whether the thought you have is.
Doctor, you are frozen. Doctor, you are frozen. One second. Kindly hold on.
Video is frozen.
No. She is not.
Sir, net disconnection, sir.
Net disconnection is there. I'll just tell her. I'll call her. Doctor, you are frozen. Yeah, please read again, please. Then I'll have to make you co-host. Okay, I'll do that. Yeah. Kindly wait, she's just joining.
Hello.
Yeah, I'll make it.
Come back.
1 second.
Sorry, sir. It was, I think, the last 2 slides.
Yeah, last question.
Yeah, just give me 1 minute. I'll set it up.
Take your time.
Sir, can I share the screen?
Oh, sure, ma. Sure.
Yeah.
Are you getting a screen share rights?
Not yet, sir.
1 second, ma. 1 second. 1 second. You have come as Varsha Udupama?
Yes, sir.
Okay. Now is it okay? Now you are on the video. I mean, you are come on the video, ma.
So just the screen share, if you could make me co-host.
Oh yeah, 1 second. I made her already. Because you have, yeah.
Made you the co-host, madam.
Okay.
1 second. Yeah. Yeah,
So is my screen visible?
Yes, it is, ma. It is.
Yes. Right. So coming to the last part, which is changing thoughts, like I was mentioning, first thing is to recognize whether the thought is making you anxious or not. Second is to evaluate whether the thought you have is correct or not. Then the next 3 strategies is seeing if you can replace it with an alternative thought, right? If my thought is something like, I cannot do this, see if you can replace it with, no, definitely I can do it. Why not? Or replacing it with a coping statement. Even if I'm not able to do it 100%, I will still be able to get the job done. Okay. The last strategy is something called thought stopping. Thought stopping is one, where you recognize that, okay, my thoughts are making me anxious right now, so I will not think about this anymore. I will distract myself with something else. So taking the cue that you're becoming anxious, stopping that thought and distracting yourself with something else. That forms the last part of this strategy. Then we have problem solving skills. For a lot of us, it might feel that if we are stuck with a problem, there is no solution to it. If we keep thinking about it over and over again, we may end up magically finding a solution that actually ends up increasing our anxiety more. So when you are faced with any problem, the easiest way to go about it is to use something called a solved strategy. So what it stands for is select the problem that you want to deal with. Open your mind to all possible solutions. List the pros and cons of each of these potential solutions. Verify the best solution and create a plan. Enact the plan and then decide if the plan worked or not. If it did not work, you can go for the second strategy or second option that you have. Now, practicing this while doing our everyday problem solving is something that can help us solve major problems when they crop up as well. Then we have something called changing behaviors. I don't think the slide is visible. Changing behaviors basically involves just two things. Listing out the behaviors that you want to engage in, but you're not able to engage in. And on the other side, listing out the behaviors that you want to cut down. For example, frequent checking or frequently asking someone if it's going to be okay, or frequent reassurance. Now, once you have noted down what is the behavior that you want to change, you simply attempt changing it and see how many times you are able to do that. It is as simple as that. Now, one of the last important things that we'll cover is sleep skills. Now, to get a good night's sleep strategy is what you can use. So I've made mnemonics so that it's easier to remember. One is set up a regular bedtime. If you go to bed the same day every day, it becomes a habit for your body and you are going to end up falling asleep easily. Then limit use of the bedroom. When I say limit use of the bedroom, I mean that the bed and the bedroom should be used only for the purpose of sleeping, not for watching TV, not for eating, or not for reading, nothing except for sleeping. The third one is exit the bedroom if you aren't asleep in 15 to 20 minutes. You've lied down on your bed, you're still not able to get sleep, it's okay. Get up, come out of there, do something which makes you feel a little tired, or do something which can keep you distracted. Then after some time, go back and try falling asleep again. Instead of just lying on the bed and trying to see if it's going to help you fall asleep, simply tossing and turning. Instead of that, if in 15 to 20 minutes you cannot sleep, come out of the bedroom. Once you start feeling sleepy, go back, right? The fourth one is eliminate naps. Now, a lot of people might actually find it relaxing and even enjoyable to have afternoon naps. What can happen is if you sleep in the afternoon, your night sleep might actually be disrupted. If at all you're feeling so tired that you have to sleep, limit it to about 1 hour, not more than that, and don't sleep after 3 p.m. Right? Now, the last strategy is to put your feet on the floor at the same time every morning. Now, what do we mean by that? It's as simple as try to wake up at the same time every single day. Whether you've had a good night's sleep or not, if you make it a habit to wake up at the same time every single day, that becomes part of your routine. Your body also gets adjusted to it and it makes easier falling asleep, right? Now, the last two slides is about preventing anxiety. Now, all the lifestyle changes that we discussed, regular physical activity, social engagement, supporting cognitive health and mental stimulation by engaging in games, puzzles, reading, all of these, healthy sleep habits, stress management, relaxation techniques, healthy and balanced diet, and getting proper consultations for your physical health conditions, strengthening your emotional resilience by, someone said, gratitude attitude, that and positive mindset. All of these are some things that will help you prevent the development of anxiety disorders itself, right? And it's always important when we realize that it's not something that is under our control, it's important to seek professional help. Okay? And the last part is about the role of family and caregivers. If someone we know is going through anxiety, what is our role? First one is to recognize that they are going through anxiety, providing emotional support to them, encouraging them to interact more and more in social situations, helping with their daily routine or having a structure for them, encouraging healthy lifestyle choices like having a good, healthy, balanced diet, avoiding nicotine or alcohol, encouraging healthy lifestyle choices, offering practical support for medical care, whether they need to be taken to the doctor or whether they need financial help with buying medications, whatever it is, offering them support for medical care. Also, facilitating professional support with a psychiatrist or a psychologist whenever required. Managing expectations and to reduce the pressure that you put on these people with anxiety. And also as caregivers to practice empathy and be patient with them. Now, these are all the things we can do to help someone come out of anxiety, right? And that is the end of my presentation.
Thanks, Doctor, for an exciting presentation, I would say. All people are excited. And, I will take another 2-3 minutes, Doctor. I think,
sure.
And I'll let you not disturb your schedule because we are already crossed our time. But I just wanted to just go through some of the things that are there in the chat box, chat window. Especially, everyone has appreciated your presentation, Doctor. So that's something to be encouraging for us. Yes, everybody has appreciated that. But there are some specific questions also that.
Yes.
The one specific question that I can think of. Thanks to Doctor. Okay, 1 second. My question is, once anxiety heated fully, is there a chance of getting relapse of anxiety in some situation?
Second photo.
For most of the people, what can happen is if you treat anxiety once, by treatment, I don't just mean starting them on some medications. It could also be giving them some coping, teaching them some coping skills, or teaching them how to change their thoughts or how to have a positive outlook. Even if there are stressful situations which come up later, this person becomes capable of handling it on their own. So there might not really be a relapse of symptoms. However, if there is a family history of anxiety disorders, there are chances that even after treatment, some symptoms might come back, although it might come back years later.
But it can be treated. It can still be treated, isn't it?
It can still be treated.
Yes. And Doctor, one more question is, sir, can doctors reduce medication gradually? I'm requesting for it with our doctor. That's one more question. See, very often we come into this situation, doctor. Especially you are more, this situation, because whenever somebody comes to that, especially this mental clinic, they will ask, how long should I take? When it will be cured? That is the first question. When it will be cured, and is the medication needed for throughout life, etc., etc. So, what is your response for this, doctor?
So this will depend on a case-to-case basis. For example, if someone has had a lot of anxiety symptoms, they've already been treated once, and after stopping medications, their anxiety symptoms have come back. So in such cases, it's not advisable to reduce their medications at least immediately. Maybe after a few years, we can try to gradually reduce, but that is a call to be taken on an individual basis. For most people, if it is simple anxiety disorder, not really complicated by anything else, we can definitely try to reduce medication, but not immediately. It's not that today I feel better, so tomorrow I reduce my medication. It has to happen gradually over the course of months.
Then one more question, how to change the irrational thoughts to rational thoughts in a person who is getting into various cycles of same thoughts and having a behavioral change.
Right. So for this, we have something called cognitive behavioral therapy, where we have a technique called cognitive restructuring. Again, it follows similar pattern about identifying whether this thought is correct or not. And if yes, what are the, if the thought is not correct, what are the alternate options? Exploring the alternate options, seeing what feels right. All of these are something that require a higher level of training and not something that is done in 1 or 2 sessions. These are some things that will be covered in a proper therapy session. But to simply put it, to explore for any alternative explanations possible. A simple example could be, I have a dinner party scheduled with all my friends today. Suddenly one of my friends calls and says, I'm sorry, I have to cancel. I won't be able to attend today. So my immediate thought might be that, okay, this person does not like me. That's why they're not attending. That might not always be the right answer, right? It could also just be that maybe that person has some emergency which has come up, which is why they are not able to attend. So seeing if there are any alternate explanations, something like that is what we generally teach.
Thanks, Doctor. That's one more question, which we very often happen to be practice. What to do if caregiver recognizes anxiety in their family members, but members refuse to agree to and that it needs attention. How to go about with this situation, Doctor? This is a very often happening. Many cases we have seen. The person is not accepting that.
Right. So it's common not just with anxiety disorders, but also with something like depression, or more commonly with substance use disorders also, where we feel that there is a problem, but the person actually is denying that there is problem. They feel that everything is normal. The first thing you can do is try to explain your concerns to them. See, I have noticed these sort of symptoms and I'm worried about you. So which is why let's go get a consultation. Try to convince them. If not, if they are not at all willing to come in for a consultation, what you can do is you can go to the nearest mental health professional or a therapist or doctor. You can go explain the symptoms, and based on the individual case details, the doctor will be able to provide you with some suggestions as to what to do.
Anyway, we have to convince them and take them to the doctor. That is the only alternative available. There is no point in fighting with them or doing anything like that.
Yes, the more we fight, the more the person feels that, okay, this person also is against me. So the less likely they will be to accept your help.
Yes. Therefore, to make them accept our help, we need to be on their side and to slowly take them. Yes, Doctor. Thank you. I mean, I think we have almost all the questions we have raised. It was one of the excellent presentations, Doctor, that we have. In fact, in the new year, I am really happy that we could have this session. Because almost everyone, in fact, we have attended the attendance of nearly 60 people. One of the best attendances I have recorded in the recent time. So 60 people have attended. Almost everyone has appreciated your presentation, Doctor. It's very useful. So for the information of our people, I tell you that this will be uploaded in our YouTube channel either tonight or maximum by tomorrow night. So anybody who likes to view it again, please they can view it, and they can also request their friends to view.
Hello, madam.
Yeah,
Hello,
yes.
madam. ನನ್ನ ಹೆಸರು ಸರೋಜಾಬಾಯಿ ಅಂತ, ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿರೋದು. 63 ಇಯರ್ಸ್. ನನಗೆ ಸುಮಾರು ಒಂದು 18 ಇಯರ್ಸ್ ಇಂದಾನು ಒಂಥರ ಅನ್ಸೈಟಿ ಇದೆ. ನಾನು ಇದು ಹೈಪೋಕಾಂಡ್ರಿಯಾ ಅಂತಾರೆ. ನಾನು ಅದು ಹೇಗೆ ಓವರ್ಕಮ್ ಮಾಡ್ಬೇಕು ಅಂತ ನಾನು ಎಕ್ಸರ್ಸೈಸ್ ಮಾಡ್ತೀನಿ, ವಾಕಿಂಗು ಎಲ್ಲ ರೆಗ್ಯುಲರ್ ಆಕ್ಟಿವಿಟಿ ಎಲ್ಲ ಮಾಡ್ತೀನಿ. ಆದ್ರೂ ಅದು ನನಗೆ ಇದಾಗ್ತಾ ಇಲ್ಲ, ಹೆಲ್ಪ್ ಆಗ್ತಾ ಇಲ್ಲ.
ಮ್ಯಾಮ್ ಕೇಸ್ ಟು ಕೇಸ್ ಬೇಸಿಸ್ ನಾವಿಲ್ಲಿ ಜನರಲಿ ಡಿಸ್ಕಸ್ ಮಾಡೋದಿಲ್ಲ.
ಕನ್ಸಲ್ಟ್ ಮಾಡ್ಬೇಕಮ್ಮ. ಈ ತರ ವೆಬಿನಾರ್ ಹತ್ರ ಡಾಕ್ಟರ್ಸ್ ಏನೋ ಒಂದು ಇದು ಕನ್ಸಲ್ಟೇಷನ್ ಮಾಡೋದೇ ಇಲ್ಲಮ್ಮ. ಅವ್ರು ಕನ್ಸಲ್ಟೇಷನ್ ಮಾಡೋದಿಲ್ಲ, ಮೆಡಿಕೇಶನ್ ಕೊಡೋದಿಲ್ಲ. ಇದು ಜನರಲೇ ಅವ್ರು ಮಾಡ್ತಾರೆ. ಬೇಕಾದ್ರೆ ನೀವು ಒಂದು ಮಾಡಿಮ್ಮ. ನೀವು ಯಾವ ತರ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳ್ತೀರಿ? ನೀವು
ಈಗ ಜಸ್ಟ್ ಅರವಿಂದ್ ರಾವ್ ಅವ್ರ ಹತ್ರ ತಗೊಳ್ತಾ ಇದ್ದೇನೆ.
ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತಾರಲ್ವಾ, ಅವರೇ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತಾರೆ. ಡೋಂಟ್ ಬಾದರ್. ಬೇಕಾದ್ರೆ ನೀವು ಒಂದೇ ಒಂದು ಮಾಡಿ ಅವರ ನಿಮ್ಹಾನ್ಸ್ ರೆಕಮೆಂಡ್ ಮಾಡಕ್ಕೆ ಹೇಳಿ. ನಿಮ್ಹಾನ್ಸ್ ಹೋಗಿ ಅಲ್ಲಿ ನೋಡಿ. ಅದು ಬೇರೆ ಮಾಡಿ. ಬೇರೆ ಏನೋ ಈ ತರ ವೆಬಿನಾರ್ ಎಲ್ಲ ಅವ್ರೇನು ಕೊಡೋದಕ್ಕೆ ಚಾನ್ಸೇ ಇಲ್ಲಮ್ಮ. ಗೊತ್ತಾಯ್ತಾ?
ಅಡ್ವೈಸ್ ಮಾಡ್ತಾರೆ ಅಂತ ಏನಾದ್ರು
ಮಾಡೋದಿಲ್ಲ. ಅವರು ತಮ್ಮ ನೋಡಿ ಇಂಡಿವಿಜುವಲ್ ಚೆಕ್ ಮಾಡಿ ಆಮೇಲೆ ಅವ್ರು ಮೆಡಿಕೇಶನ್ ಕೊಡ್ಬೇಕು.
ಪಬ್ಲಿಕ್ ಪ್ಲಾಟ್ಫಾರ್ಮ್ ಅಲ್ವಾ ಅಮ್ಮ, ಅದಕ್ಕೆ ನಿಮ್ದು ಪರ್ಸನಲ್ ವಿಷಯಗಳನ್ನು ನಾವು ಪಬ್ಲಿಕ್ ಅಲ್ಲಿ ಡಿಸ್ಕಸ್ ಮಾಡೋ ಹಾಗಿಲ್ಲ ಅಂತ. ಅದಕ್ಕೆ ನೀವ್ ಇಲ್ಲಿಗೆ ಬಂದ್ರೆ 1-on-1 ಕನ್ಸಲ್ಟೇಷನ್ ಮಾಡ್ಬೋದು.
ಓಕೆ ಮೇಡಮ್, ಥ್ಯಾಂಕ್ ಯು.
Doctor, can I speak?
Please go ahead.
Can I speak? That was a really wonderful, informative session. I just request you to, is it possible to share that PPTs for us?
Yes,
I really very much
definitely.
interested to note down all the points. I can
Definitely.
help others also.
Sure.
Thank you a lot.
I can share it with sir, and maybe he can share it with you.
No, I don't catch you at all. I don't catch you. What is that? What is your
PPT, the PPT I presented.
This is available in YouTube, ma. The same entire presentation is available in YouTube. It is a free channel. Anybody can see Vayomanasa Sanjeevani.
Sir, 1 second. You are right. It is available. I see every page I need to sit and write. If only the PPT is shared, I can make a note of it or take a printout to help others.
That is right, ma. But okay, we can try, ma. We can try. Let doctor share it with me, because they also have they have got their own this thing, isn't it? Some of the PPTs they may not like to share it openly also. But anyway, if the doctor
that is the reason I requested doctor directly. There's no problem. If she is not interested, no issues.
No, I can share it, ma'am. No problem.
We can try, ma. We can try, because in the past we have done it.
I try to make lot of notes, but it's still there are a lot of points, excellent points, which I was not able to do it. So I thought, let me make a note of everything so that I can help others. It will be useful for me also. I am a special educator and a teacher and a volunteer for NIMHANS.
When I know your name, ma?
Bhuvaneshwari, sir.
You are not coming on video, ma. I have been requesting.
I am there in the video. Yes, I am there in the video.
No, it's not there, ma. See, let me see.
I am there, sir. I am there in the video.
I must be able to highlight you.
Can you see my hand?
I am not.
I am there in the video. I am in video. Others also not able to see?
No, your bandwidth is very low. Your picture is very small. I think you are talking in a mobile.
Yeah.
Of course, I am in mobile. Yeah.
Yeah, your bandwidth is very low, 4G or something like that. Not 5G.
No, okay.
I'm seeing it. Okay. Okay, madam. Yeah, this is fine. Okay. This is fine. So, I mean, with this, I think I need to respect the doctor's time. Already it is.
Sir, can we get the recording, sir?
Sure. It is available in our YouTube channel, ma. Padma, madam, if you want, I will also share it with you personally. Don't bother.
Okay, sir. Thank you so much.
That we'll do that.
I hope now you can see me.
Yeah, definitely. We are seeing you. Therefore, it's always better. That's my request is that whoever is talking, please come on the video so that you are visible to everyone. That's the only request. Okay, thank you, ma. Thank you, doctor. See, the doctor is not. Doctor is quite young. That the thing is, at this age, if she is able to make so much of contribution, I'm just thinking what kind of contribution she can make in another 10 years or 15 years. So thank you very much, Doctor. See, we are all you have been able to capture all the seniors very quickly through your presentations, through your good looks, through your the nice way of talking, everything, Doctor. Thank you very much. So as we always wish, I am joining with all of my other colleagues here and wish you that may God shower on you and your family all that are the best in life. That is our best wish. So here also in this wish also we have got one fine expectation that you continue to serve the society better. You continue and society be benefited out of it. Thank you. God bless you.
Thank you.
Thank you. Thank you. Ma'am, I am Vegopal from Wellbeing Volunteer NIMHANS.
Okay. That's right. So with your permission, can I close down, Doctor?
Sure, sir.
Huh?
Sure, sir.
Can I?
Thank you.
Thank you. Thank you.